Men, do you have bowel or urinary dysfunction? In other words,
Do you have to strain whenever you poop?
do you notice pain or a burning sensation when you urinate?
Or do you have dribbling that might wet your underwear?
Does it take you a long time to get going when you pee?
Do you have to wake up in the middle of the night to pee?
Do you experience hemorrhoids?
Then as a pelvic floor specialist, this might likely indicate that you have some kind of pelvic floor dysfunction.
Hey guys, it's Dean from Manful Yoga. This is Lance, and in this video, we are going to be helping you better understand bowel and urinary dysfunction for men, and also helping you get started on fixing the issue with the appropriate strategies and exercises. Be sure to watch the full video because Lance here is going to be giving you the exact information that he gives to patients that he sees in his clinic. So I'll turn this over to Lance. What are some common forms of bowel and urinary dysfunction?
So let's start with bowel dysfunction. Typically, people with some kind of bowel dysfunction have pain with defecation or having bowel movements. They might have to strain really hard. They might also have frequent hemorrhoids, or they might even get tears in the rectal canal called fissures. From a urinary standpoint, people that have issues with peeing might have what's called urinary urgency or frequency. They have to pee really bad, or they have to pee really bad all of the time. People might also have some sort of dribbling issue where they go to the bathroom, they finish, they put everything away, and then a little bit of urine comes out that might wet their underwear or even their pants when they leave the bathroom. Another common complaint is that people might also have to wake up more than once in the middle of the night to pee. That can be, sleep is important and it can be kind of bothersome for people. So that's another big issue that I see in the clinic.
These are all kind of differing symptoms, but is there a uniting underlying cause?
Generally, it's a function of a pelvic floor that isn't relaxing fully all the way. So there's holding tension all of the time. And so trying to do these basic functions becomes really difficult whenever the muscles aren't able to relax to do those functions.
So it's not an issue of weakness?
No, usually it's an issue of too much tension.
Got it. So what are the things that we can do to help with relieving that tension?
Well, first is being able to recognize what the pelvic floor is and what its job is, and learning how to release that tension through our breath work and being able to control those muscles willingly. And then also working on just general hip flexibility and pelvic mobility.
Got it. So first thing is pretty specific. Need to learn that technique. Can we do that in person, or do we need to be in person for that, or can we learn it, virtually or via video?
You can learn it virtually. People, as long as they know kind of what muscle groups we're talking about and how to sync that up with their breath, it's a really easy task to learn.
Got it. And then the hip flexibility stuff, is that similar to what you would see in, yoga?
Right. I mean, your following is used to all of your yoga routines and mobility work, and that was a perfect pairing for somebody with pelvic floor dysfunction.
Got it. Is there another important component to this? The stretching, the training the body, the training the right muscles?
Also, learning how to manage stress is huge. People with an overactive pelvic floor generally tend to hold a lot of tension in the pelvis, and that's usually due to high stress, high anxiety, just type A, tight-ass type people. And so working with a mental health therapist or doing more yoga can help with just down-regulating the nervous system to help with overall stress and tension.
All right, so we talked about constipation. We talked about dribbling after you pee. We didn't talk about incontinence, though. Is this a related issue, or is that different?
Usually, even though it's a urinary dysfunction, usually incontinence is a function of a weak or an underactive pelvic floor. Doesn't typically fall into the category of an overactive pelvic floor. Those people just need a little bit more strengthening, whereas with everything that we just talked about, those people just need to learn how to relax the pelvic floor.
Got it. So if you guys have incontinence issues, check out another video we did on that because it's a separate issue. All right, so since most people probably can't go see you in your clinic in Atlanta, we recorded a 10-minute workout for you guys to start working on releasing and relaxing tension in an overactive pelvic floor. So this combines the breathing exercises that Lance talked about as well as some hip flexibility exercises. And if you do this regularly, hopefully it will help, right? How often does it take? How often should they be doing it?
Definitely every day, ideally twice a day for the first few weeks, and then for a total of 6 to 8 weeks is the general time frame that I give patients in the clinic.
Got it. All right, guys. So there's your homework. You've got the 10-minute routine, 6 to 8 weeks. Do it every day. The link for that workout is in the description here below. Before you click it, though, please like this video, leave a comment if you have some feedback or a question, and then subscribe so you don't miss out on any other Manful Yoga workout videos or videos from this Pelvic Floor series here with Lance. And then make sure you check out Lance.
You can find me on YouTube or Instagram or TikTok at Lance in Your Pants, or you can check out my website, flexptatl.com.
All right, here is that video for you guys to get started with. Again, 10 minutes, 6 to 8 weeks, and hopefully within that time period, your urinary and bowel issues will start to improve. Thanks for watching. See you in the next video.